Heart disease is the #1 killer of women in North America. We're discussing what women should know about heart health and what we can do to prevent future issues with cardiologist Dr. Tara Sedlak. Before we get started, tell me in the comments where you're watching from and let us know if it's your first time joining us. Dr. Sedlak, thank you so much for being here with us.
Thanks for having me.
I was shocked recently to hear that nearly 10 times more women die from heart disease than breast cancer, and yet I think we hear so much more in the media about breast cancer. Let's set that straight now. What should women know about the prevalence of heart disease?
First and foremost, I think that's a great comment about heart disease being more common as a cause of death than breast cancer. And in fact, it's one of the major causes of mortality amongst women in Canada. So, a very important disease to look at. And really, for the longest time, the mortality or death rates were pretty steady in women. They were decreasing in men, but pretty steady in women. And only recently, I would say in the last 10 years, have they started to decrease. And a lot of that is because of attention we've paid to women and heart disease. For example, education, some advocacy movements that have been done, and also some new research that has come out.
So, heart disease is kind of a general term. What are the different conditions that are under that umbrella?
Yeah, so when we think about heart disease, there are many different formats that it can take. The most traditional thought about heart disease is looking at a lack of blood supply to the heart. And traditionally speaking, in both men and women, that's from blockages or cholesterol plaque in the arteries that can lead to a lack of blood supply and often leads to chest pain or something called angina. But there are other forms of heart disease. Certainly, there are arrhythmias that we can see, particularly in women. One of those is atrial fibrillation, which is an irregular heartbeat. And then there's another form of heart disease called heart failure. And that's really where the pumping function of the heart is not strong enough to pump blood forward. And instead, blood pumps backward into the lungs and can give you shortness of breath, and into the legs and can give you swelling.
So, how do the different stages of a woman's life, pregnancy and menopause, for example, affect her heart health?
So I really consider events in a woman's life, such as pregnancy and such as menopause, as a window into looking at their cardiovascular health. And what I mean by that is, for example, when a woman is pregnant, and if she has high blood pressure during pregnancy or an event called preeclampsia, which is really where you can have very high blood pressure. Sometimes you can have elevation in liver enzymes, sometimes lots of swelling, and sometimes you even have to deliver early. That is actually a very powerful risk factor. It can double a woman's risk long term for cardiovascular disease. Similarly, with regard to menopause, if a woman goes through early menopause, the average age of menopause in Canada is 51. But if a woman goes through early menopause before the age of 40, again, she can be at increased risk for cardiovascular disease down the road. So some of these risk factors are just very important to look at in a woman's life so that she knows whether she's at increased risk and then can take care of that early on.
So, what I hear you saying is issues during pregnancy or early menopause are almost kind of like a sign to you as a physician that we may need to pay a little more attention here.
Yeah, I think that's a great summary. We call them sex-specific risk factors because they obviously don't happen in men. And for the longest time, they weren't even studied because most studies were done in men. Two-thirds of research was done in men in cardiovascular disease. And so they weren't even looked at until more recently when we said, hey, let's have a look at pregnancy. Let's have a look at menopause. What are the risk factors there? Are they important? And we're definitely determined that they're important and need to look at them more in women.
We are going to pause here and do our trivia question. Folks, if you answer this question in the comments, you'll get a collection of heart-healthy recipes created by our dietitian. And that question is, true or false, regular exercise can help lower the risk of heart disease? Is that true or false? Can regular exercise help lower the risk of heart disease? You will probably hear the answer in this episode if you listen carefully, but put your best guess in the comments and you will get those awesome recipes delivered to your Facebook Messenger inbox for free. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. Dr. Sedlak, are certain heart conditions more common in women?
Yeah, so there are definitely some heart conditions that are more common in women. In particular, we've done a lot of research at our institution into this. So, for example, I mentioned earlier on in the episode that the most common cause of chest pain in men and women is blockages in the arteries surrounding the heart. And still that's the case, both in men and women. However, what we've found in our research is that up to 30% of the time when a woman presents with chest pain, and up to 10% of the time when a woman presents to the emergency room with a heart attack, it's actually not due to the large blood vessels at all. In fact, we do the gold standard test where we put a catheter or a tube up to the heart, put dye into the arteries, and the arteries are completely normal. And in fact, what we're finding in women is that there's other causes of heart attack and chest pain. And some of those are small vessel disease, what we call microvascular dysfunction, where it's actually the small blood vessels surrounding the heart that cause the issue. Some of that is spasm of the arteries surrounding the heart. And what I mean by that is where the arteries can start off really normal and then can spasm down just like a Charlie horse and then sort of let back up again. And that's hard to catch because you have to kind of catch it in its action. And then finally, there can be little tears in the arteries, so-called dissection, or something called spontaneous coronary artery dissection, or SCAD, which is a tiny little tear in the artery. And if you're not really looking for it and you're just looking for major blockages in the arteries, it can be missed, even on our gold standard test.
So, does heart disease manifest differently in men versus women?
Yeah, it definitely does. I think with regard to symptoms in particular, there can be differences. Still, the most common symptom of a heart attack in particular is chest pain, and that happens in both men and women. But what can be different is the description of chest pain. So interestingly, women can describe their chest pain more as tightness or a little bit of pressure on the chest, as opposed to men who classically will describe it as an elephant on the chest, which is what we think of when we think of a heart attack. Other symptoms that a woman can have, she can have shortness of breath, she can have sweating, she can have fatigue, and she can actually have pain in other areas of her body. So sometimes she can have pain in the jaw and not necessarily in the chest, or pain down the arm, or pain into the back. So really, we have to have a low level of suspicion, particularly when a woman's presenting to the emergency room with new and ongoing and worrisome symptoms, to check for a heart attack, even when the symptoms are not classic.
So, is it true that atrial fibrillation is more common in women than men?
So atrial fibrillation is more common in women, and a lot of it is age-related, where women live longer than men. And so atrial fibrillation is commonly found in a woman in her 70s or 80s. And so we're picking up on a lot of atrial fibrillation in women. One of the biggest issues, however, has been actually diagnosing it and picking it up. Women don't necessarily describe classic symptoms. They've been investigated sometimes later on in the course of their atrial fibrillation. And so unfortunately, sometimes the presenting symptom is actually a stroke, and those strokes can be massive. And so we're trying to develop technologies for picking up on atrial fibrillation earlier, particularly in women.
And if someone watching at home has been diagnosed with atrial fibrillation, anything that they should be doing about it?
So I think there's a couple of things. There's two main issues with atrial fibrillation. One is that there is a small stroke risk, or it could be a larger stroke risk, depending upon other risk factors. And so if you have atrial fibrillation, having a really detailed conversation with your healthcare provider or with your specialist around whether you need to be on a blood thinner to try and prevent stroke in atrial fibrillation is really important. And then the second issue in atrial fibrillation is heart rate. So where heart rate can sometimes go very fast, and with that you can get really quite dramatic symptoms. And some patients present to the emergency room and even need a small shock to the chest to get them out of it. And so thinking about, how symptomatic are you with your atrial fibrillation, and do you need to look at medication or even a minimally invasive procedure to try and take care of symptoms and heart rate in atrial fibrillation is important.
So, how might a woman know if she's at risk for heart problems in the future?
So I think there's a couple of ways that a woman can look at her risk. Number one is looking at her sex-specific risk factors, which we already talked about, pregnancy-related risk factors, menopause-related risk factors, but also traditional risk factors are very important. So blood pressure, cholesterol, sugar count, whether you have diabetes, family history, smoking. There's even some newer factors out. There's a marker now, a genetic marker for cholesterol called Lp(a). And the new guidelines would suggest that you're supposed to get it checked once in a lifetime. And that may change over time as guidelines update. But if that's elevated and you have family history of heart disease, that's just a marker that you should get checked more frequently and get your other risk factors checked, and maybe even go on medication if some of those risk factors are not normal.
So, what are the numbers that women should be tracking with their doctor on a regular basis to understand how their heart is doing and what their risk for heart disease is?
Yeah, so I think important numbers to track, certainly blood pressure. Classically, we'd love to have blood pressure 120 over 70, 120 over 80. Certainly, we treat when it's higher than 140 over 90 or 135 over 85. So I think those are very important numbers. I think cholesterol and knowing your numbers for cholesterol is very important, and knowing your numbers for sugar, whether they're normal or abnormal. And if you do have diabetes, trying to get your sugar down as low as possible is very important. And then finally, things such as weight is important to track. And I think we'll talk a little bit more about that in some upcoming questions. But I think weight is one of those things that you can certainly track and look at over time.
Do you recommend that women check their blood pressure at home if they've been told that they have high blood pressure?
Yeah, I think checking your blood pressure at home is very helpful. I would say that in 90% of women, it's a really accurate way to monitor blood pressure. Number one, it's done in a more relaxed setting because often you're rushing, trying to get into a doctor's appointment or trying to get into a cardiovascular test, and you're nervous. And so sometimes blood pressure can be actually quite high in the doctor's office and yet normal at home. There's a small percentage of women that find it anxiety provoking to be checking their blood pressure all the time. And in fact, the more they check it, the higher it gets. And so if you're one of those people, it may not be as helpful. But I think if you're in the 90% of people where it's accurate and more accurate, certainly than going into the doctor's office, then it's very helpful.
In case you're just joining us, we're here with cardiologist Dr. Tara Sedlak talking about what women should know about heart health. And we're giving away an amazing collection of heart healthy recipes if you answer our trivia question, which is true or false, regular exercise can help lower the risk of heart disease. Is that true or false? Can regular exercise help lower the risk of heart disease? Put your best guess in the comments and you'll get those recipes delivered to your Facebook Messenger inbox for free. Okay, Dr. Sedlak, let's talk about prevention. That's really the good news. A lot of these issues can be prevented. What can we do now to prevent heart issues in the future?
So I think there's a few things that women can do, or probably more than a few, but certainly a few come to mind. Number one is making sure that they know their numbers, get all of the risk factors checked on a regular basis. Number two is living a healthy lifestyle. So we're still recommending the Mediterranean type diet, although there's lots of diets out there, but that's a classic one that we're recommending for somebody who has heart disease or who's at risk for heart disease. Number three is really regular exercise. We're recommending exercise up to 5 times a week, 30 minutes at a time, and really trying to get your heart rate up and get into an exercise pattern where you really can't carry on a conversation. That's sort of considered cardiovascular exercise. And then finally, and I mention this in all the talks I do, I'm a really big fan of mental health and taking care of your mental health. And in fact, stress, anxiety, and depression is actually a risk factor for heart disease, and it's actually a stronger risk factor for heart disease in women compared to men. So taking care of your mental health, I think, is also very important.
There was a recent study that showed that alcohol can raise our risk of heart disease, particularly among women. So, what should women know about alcohol and heart health?
So with regard to alcohol, I think higher levels of alcohol can increase your risk of heart disease. In particular, alcohol can increase your risk of atrial fibrillation. There's a syndrome called holiday heart, which is essentially if you drink too much alcohol in one setting, you can actually put yourself into atrial fibrillation, which is that irregular heart rate that we talked about. Alcohol is also not good for people who are at risk of or who have heart failure, and that's the sort of water on the lungs, water on the legs that you can get from a problem with pumping function of the heart. And so I think really adhering to the new guidelines of a few drinks a week makes sense, particularly with regard to preventing heart disease.
So, let's talk about the connection between weight and heart health. What do we know currently about how these two conditions intersect?
So number one, weight increases some of those cardiovascular risk factors that we talked about. So increased weight can increase blood pressure, can increase blood sugar, and can potentially lead to diabetes, and can also increase cholesterol. Furthermore, we know that increased weight can lead to a syndrome called sleep apnea, which is essentially where you can stop breathing overnight and have troubles with oxygen overnight. And sleep apnea is actually an even bigger risk factor for high blood pressure, heart disease, atrial fibrillation, which we talked about. And then finally, we know that increased weight actually can stiffen blood vessels and can stiffen the heart. And so, in particular, what we can sometimes see in patients who have been overweight for long periods of time is that, in addition to high blood pressure from stiffened blood vessels, you can actually get stiffer heart. And so, the squeeze of the heart is actually normal, but because the heart itself is quite stiff, some of the blood can back up into the lungs and legs and cause heart failure, which we've talked about before, but actually heart failure with what we call preserved pumping function of the heart, where the squeeze of the heart is still good, but the heart is stiff and it's just not able to relax, and you can get heart failure from that. So those are some of the important entities that we know are connected to obesity or overweight status.
How can we figure out if our weight might be impacting our health? Is BMI the right metric to be looking at?
So BMI is one measure, and certainly a lot of clinics and a lot of physicians still measure BMI. But another good one is actually waist circumference. And a lot of studies have shown that waist circumference is actually more closely tied to cardiovascular disease and cardiovascular risk than BMI. And so if you have the capability to measure waist circumference, that can also sometimes be helpful.
So, how much weight do we need to lose to see positive benefits for our heart?
So in terms of benefits for heart health, I think if you're looking for weight loss, about a 5 to 10% weight loss, at least in the research literature, is considered a significant amount of weight loss, such that you can start seeing things like lower blood pressure, patients being able to come off some of their blood pressure medications, lower sugars, better diabetes control, and better cholesterol control. So that's one of the markers we look at.
Do you recommend to your female patients that they focus on reaching a healthier weight?
First and foremost, what I talk to them about first is actually exercise and diet. So I focus on that first because I think there are so many other benefits to that, that even if you don't have weight loss, I think exercise and having healthy diet alone are very important. And in fact, there's actually really good studies out to show that even if you don't lose weight, but you have regular exercise as part of your regimen, you're actually much healthier than those patients who don't exercise at all. But then, once I've talked about diet and exercise, then certainly I will sometimes talk about weight, in particular if they want to talk about it. And then we'll talk about various strategies in addition to lifestyle and sometimes medications in order to achieve their goal in terms of weight.
If someone has already had an event, like a heart attack or stroke, what can she do to prevent another event?
First of all, getting really good control of risk factors. We talked about a lot of those: blood pressure, cholesterol. If you have diabetes, getting really good control of risk factors makes a big difference in terms of preventing another heart attack. Stopping smoking, engaging in exercise and diet, and also taking care of mental health, because stressors can be a big risk factor for heart disease. And then finally, what I try to get women to do, or men and women, but in particular women, is to enroll in something called cardiac rehab or a healthy heart clinic. And what this is it's a clinic that's available at most major hospitals, and is available to patients after they've had a heart event or after they've had heart surgery. And it's an exercise and dietary program, often for 3 to 6 months, but often longer. And it gives you a lot of education, a lot of reassurance about exercise. It teaches people how long they should exercise for, how high their heart rate should go, what kind of diet they should follow. And it's really a good clinic. And what we know is that in women, they actually tend to attend a cardiac rehab less so than men. And even if they do enroll in cardiac rehab, they tend not to finish the program as much. And there are many factors behind that, but really I try to emphasize it for women. It's a good program. It actually reduces mortality and death rates long term, reduces hospitalizations. And so trying to get women into cardiac rehab and staying in cardiac rehab is actually really important.
Dr. Sedlak, I know you're super engaged in your community around women and heart health issues. For the folks watching at home, what are some advocacy opportunities for anyone who's interested in getting involved in raising awareness of this important issue?
So every year in February is Heart Month, so we hold a Wear Red Canada campaign. And this is a cross-Canada campaign held on February 13th, the day before Valentine's Day, where everyone gets out in their community. They wear red for women and heart disease. They get on social media and they tweet or go on Facebook and relay messages about how you can prevent heart disease or take note about heart disease or get control of your risk factors. And then finally, a lot of us get out and speak to the community about heart disease. So if people are interested, get in touch with me. There's a lot of advocacy campaigns going on during February and also on February 13th, Wear Red Canada Day.
Last question, Dr. Sedlak. What is the number one thing you wish women knew about heart health?
I think just recognizing that heart disease is a major killer amongst women, and recognizing that there are risk factors, many of which are modifiable. And some of those are blood pressure and cholesterol and exercise levels and diet and sugar. And all of those are modifiable, where you can make a decision to try and modify your lifestyle and therefore help control your risk factors better. I think it'll go a long way in terms of preventing heart disease long term.
Dr. Sedlak, thank you so much for joining us tonight. This has been such an informative and important conversation.
Thanks for having me. I had a great time. Thank you.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, regular exercise can help lower the risk of heart disease? The answer is true. If you didn't get to answer the trivia question, but you'd still like that collection of recipes, leave a comment for us and tell us what you thought of the show. We'll be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.